Hello, I'm Dr. Timothy Wilson. I'm professor and chair of urology and urologic oncology at the Providence St. John's Cancer Institute in Santa Monica, California. And today we're here to introduce you to Dr. Ram Narayanan, who's a young urologic oncologist, urologic cancer surgeon, recently recruited and brought back to Santa Monica. And talk to Ram about who he is, where he's from, and what he does, and how he does it. So with that, welcome, Ram.
Thanks, Tim.
Tell me about your early history. Where you're from, where did you grow up?
Sure.
And where you went to college and that sort of thing.
So I was born in India.
Yeah.
And the running joke is that my brother and I got so Americanized so quickly because we moved from India to South Carolina and Charleston. So whenever we visited our relatives, they would just say, "Oh, here comes Bill Clinton and George Bush."
So then, and after high school, where'd you go to college?
So I went to Cornell University. So when I was growing up in the South, I wanted to basically see, we thought we were just going to go somewhere in the South like Duke. But when we came to New York, my parents wanted us to stick around, and then we I looked at between Columbia and Cornell, and the Cornell atmosphere was just very nice campus, and it was just very quite pretty, and so I had a great time there. Yeah.
Did you know that you wanted to be a doctor when you first went to college, to university?
No. I actually, because of just how we were brought up, there was just always the science in the background. I said I wanted to try something different, so I wanted to be an English major.
Really?
So yes. So I went. I wanted to be an English major, so I went as an English major. And after I read the Canterbury Tales about the second semester, I said I can't do this. So, and then I think you naturally gravitate toward what you're good at. So I always liked, I liked helping people. I wasn't very argumentative, so I think the law route that wasn't going to work. And for some reason, we just never grew up around business. So, as kind of came full circle to just go towards biology and the pre-medical sciences. That just came as a natural fit.
Did you graduate in biology?
Yes. So I ended up just graduating in biology. And then because of I was looking at different things of what I wanted to potentially do. By the time I had graduated, I wanted to I had to fit in some additional classes, so I ended up doing a master's after graduation.
Right.
So I did that in biology, sort of biochemistry at NYU.
And then how about medical school?
Yes. I wanted to pick something that was in New York and affordable. So there were two big state schools in New York, and I fortunately got into Buffalo, which is the biggest state school in SUNY school in New York, and it was wonderful. So we got very fortunate.
So medical school was a good experience for you?
Yes, I loved medical school. So it was SUNY Buffalo. The nice thing about that the way the medical school is set up is that you're really only the only institution in the entire city. So it's a city with a greater population of about 1.2 million people. And you see everything. The amount of pathology you see in Buffalo is, I think it rivals some of these major medical centers easily. So we got to see a lot of good pathology.
Yeah, and I met you shortly after that, or when you were finishing your training and you were interested in doing a fellowship in urologic cancer, urologic oncology. Yep. And what attracted you to that kind of work?
I wanted to do some research in a field of medicine because I really didn't know what I wanted to do. I looked up, one of our alumni, who's at Harvard, Beth Israel Deaconess, a guy named Andrew Wagner. Yeah. So he did robotic surgery, and I thought, I played video games growing up. I thought, oh my gosh, this sounds cool. So this is the first time. It was the first time I saw the Da Vinci robot, and I didn't really know what urology was all about as a first-year medical student. But I ended up going to see him, and he took me on for a summer, essentially, internship or fellowship to develop this trainer for robotic prostatectomy, actually. So we used this porcine model with real tissue to try to help the residents sort of do the urethrovesical anastomosis, and which at that time I didn't know what that really was. I was like, oh, I just get to spend some time in Boston and play with this robot. That sounds cool. But yeah, that's how the interest started. So everybody that I met, the urologists there were wonderful, really gregarious, funny, and the technology was very cool. As I went into residency, that interest in urologic oncology, which is where robotics is just really intertwined, is of course, I think you know something about that.
Yeah.
So that's where the interest kept kept going.
So what do you like about? I mean, urology is kind of an offbeat specialty, right? So what makes you proud to be a urologist?
No, excellent question. It's just such an immediate delivery of just help for patients. It's just it's such a tangible thing sometimes when you have a stone that's causing pain, you can treat it and immediately make someone feel better.
Yeah.
When a gentleman can't urinate, you can do something about it and immediately feel better. So, the urinary system, the genitourinary system is such a critical aspect of your day-to-day quality of life for both men and women. So I think for me that the ability to deliver that level of care and to allow any man or woman that has these issues to help them out in a very straightforward and sometimes very complex way for even a somewhat simple problem. The challenge of that aspect is also very, very, very attractive.
Most urologists these days, as you know, would like to finish their residency and then maybe do one more year in fellowship. But you did 2 years. You did 1 year here doing translational research and some outcomes research with me and in our department and Dr. Hoon in his lab. Tell us about that a little bit.
So in Buffalo, our training program, we had 5 years of just very heavy clinical work. We had no research exposure. I just always like to be looking at the mechanism of actions of certain different disease pathways. So that interest for understanding and delving a little more granular into certain disease pathways and processes was always very interesting to me. So having the chance to do research, especially, I think I've told this to you many times, in an unbelievably gorgeous place like this, it was a no-brainer. As I remember, I think before the time when I was applying for fellowship, you were just, I think, getting recruited here from City of Hope. So I remember my wife, took a look at Duarte and took a look here and said, "You're coming here." So
what was the weather and the location?
and
the palm trees.
And beyond that, I think meeting you and Jen, Dr. Linehan, of course, and Dr. Hoon, Dr. Twardowski. So it was just really such to this day, it's been one of my favorite parts of urologic training, period.
Well, that's great to hear.
Yeah.
You spent almost 3.5 years in practice, primarily in Buffalo, and some of the guys that helped train you during your residency.
Yeah.
And then obviously we were able to recruit you back. But tell me about your experience in Buffalo as a practicing urologist, urologic oncologist, and how that prepared you for what you're going through now.
Yeah. So Buffalo, again, the practice of Western New York Urology Associates, which is, a world-class practice. So they also cover the residency. So you have, several very talented physicians in a sort of this large, essentially urologic supergroup there, and they again are seeing everything in the city. So between that group and Roswell Park Cancer Institute, which I was from, your friend and our mutual friend, Dr. Khurshid Guru, you're really the only game in town essentially to sort of see a lot of pathology. So my practice at Western New York Urology Associates, prepared me to see a lot of complex both cancer surgeries and also a lot of complex general urology, especially, for example, doing PCNLs, which go right through. Not a lot of people do that without very specialized fellowship training and in different institutions. So in my practice now, we routinely do PCNLs.
So it's that's a complicated surgery for people that have stones inside the kidney that are too big to break up with Eswal or Shockwave, I guess.
Or ureteroscopy.
Yeah,
exactly.
Right, exactly.
Yes. And that's something we did so routinely over there that it just translated easy to do in practice here.
I see, sure.
And then a lot of open surgery is, I think initially one of the first cases that I got here was that 22 centimeter kidney tumor. Again, we would do a lot of open surgery, so that was it became very comfortable to do those kinds of those cases. But
absolutely. Obviously, we were, as our program grows here, we were fortunate to be able to have a position and partner with another kind of sister hospital within the Providence system, St. Joseph's Burbank, where the Disney Family Cancer Center is. And so I know that obviously we're in the, you've joined our program here, thank goodness. but you're primarily in Burbank at the Disney, although you spend about 20% of your time here doing research and treating patients with urologic problems. Tell us about the Disney Family Cancer Center.
Yeah, the urologic oncology program there has really taken off like a rocket. So the amount of positive feedback we've received from just the physicians of Burbank, the community physicians there, and even the community urologists who have seen what we were trying to do in Burbank to sort of create this model where they really can come to us for the entire kind of gamut of urologic health. So when I started the program, when I got recruited, I should say, to start that program, even the name we chose for it was the Center for Urologic Health. Of course, urology sort of naturally gravitate towards men's health, but of course there's several urologic malignancies that afflict women, complex stone disease, even simple issues that, let me rephrase, even issues that seem as simple as I'm leaking urine could have tremendous ramifications where men and women both. So we have a lot of new state-of-the-art techniques for even something from female incontinence all the way to something as complex as like a surgery upcoming for us, that a small cell carcinoma of the left collecting system. In a lady who initially came in with just blood in the urine that she wanted to get worked up.
Right.
So we really have kind of created set up a foundation where we really want to grow that program, bring in more providers, especially future trainees from the trainees that we are able to pass on our skills to. I think the opportunity is just really incredible.
And the relationship between the St. Joseph's practice and the Disney and the St. John's Cancer Institute and St. John's Health Center, how do you see that working?
I think it's really a match made in heaven. Basically, we've had several patients now that have really complex complex disease pathways, whether it's muscle invasive bladder cancer. The patients now will, as different centers are regionalizing, to make centers of excellence. So, for example, St. John's is a bladder cancer center of excellence. So we have patients that will come in and get everything, worked up in Burbank, and let's say they need the cystectomy, and they will come here, get the complex surgery, and then maintain all of the follow-up in Burbank. So it's really just to come for the complex surgery and then stay local. And because I primarily practice there, and I also have the ability to sort of go back and forth, that allows me to sort of keep the patients really in the Providence network. They never feel like they're so fragmented or leaving, and we have had not a single complaint about the drive over the 405. So, because they know just how much they're.
Yeah, that's odd, because I know I whenever I'm on it, I complain about it. And because again, I practice what I preach, so I live it. So I drive and come here to do the surgery, see them back, and I think they appreciate that continuity of care, and they know they're getting excellent care. So and all of our outcomes have been really, really wonderful. So the community is very, very happy with it. But as the program develops, we can obviously start to do more complex surgeries at St. Joseph's Burbank. Sure.
I can't say enough amazing things about that hospital. So the OR staff there are fantastic. The leadership, the administrative leadership is wonderful. So they're really supportive of what we're trying to do. And I think I definitely see that along both sides. So it's really a good opportunity to become a really strong force in the LA area.
Tell me, I know there's a little bit, you're interested in developing some community-based programs for public health impact throughout concentrated initially maybe in Burbank, but could progress throughout the Los Angeles area. So tell me about that.
Yeah, so there's two initiatives in this now. We've been in Burbank now for about a year, and now we want to incorporate a couple of, really, I think, very meaningful initiatives for me. So especially with communities of color. So we know that Black and Brown communities, they have hesitation towards, going to, several, there's multifactorial reasons there, but essentially the trust of the physician to sort of, care for communities of color, for patients that may not understand exactly what's going on in oncology. Historically, they may not have, been able to get access to the, to this high level of care. The goal for what we want to try is basically, promote the message of early urologic evaluation, which means PSA screening, which a lot of primary care doctors do a fantastic job. The hesitation, I think, is, as evidenced by, for example, Defense Secretary Lloyd Austin, that sensitivity, we want to basically break down that barrier. Credit, for example, to the breast cancer,
Sure.
To women with breast cancer, they will talk to as soon as, a woman gets diagnosed with breast cancer, her friends, her family, all come around and support. So that's what we want to try to emulate in urology, in men. Exactly. So just to make, prostate cancer is the most commonly diagnosed malignancy in the US. As I think you famously said, in one of your articles when I was reading, I think before coming to the fellowship, you said, there's a bury your head in the sand approach or take it head on approach. So I think what we want to try to do is make sure that, men are totally comfortable talking about it, and especially in very culturally sensitive communities. And I'm Indian, my parents still don't go to the doctor, but I'm working on it. Finally, they are now. But yeah, that's what we're trying to get that message across. And so the more the more you engage the community that way and show that we really care, then I think that pathway becomes so much more beneficial for everyone.
So obviously I won't be here forever. It's young guys like you that'll take over and develop this program in the future. What do you think some of the important questions that we have to answer and work on? With Dr. Hoon upstairs in translational research, what questions do we have to answer, and what things do you think are on the horizon?
Mm-hmm. So, essentially, I think next generation sequencing, from when I looked at it from even as my early exposures, even as a translational fellow. I at that point, precision medicine, the incorporation of genetics and genetic testing, it's that really tailored approach to every single person's cancer. That's where I think the next big phase, it's already here, but it's what we're trying to do is, I think, look at that in an actionable way. One thing we talk about, for example, is, if we can figure out a way on the prostate biopsy, for example, if we can take a look at which one of those men would have a high risk of prostate cancer nodal metastases, for example. Right. And, it's something where NGS can really help sort of direct that kind of surgical approach.
I'm still amazed because I didn't know enough about this Cancer Institute when I was initially recruited here, that the quality of science and the laboratory resources that are here in this little place are incredible. The ability to sequence the entire genome in the sequencing laboratory down the hall is phenomenal, and the kind of access that, as a result of Dave Hoon, who's been a scientist here for 30 years, resources he has and the people he knows, we have really access to all technologies available in that kind of science, in that kind of medicine. It's amazing to me.
It's amazing, and it really, I think, speaks to, if you look at it, if you take that example that you just gave and look at how our urologic oncology program is sort of positioned, it's really that. It's that way where we are delivering, I think, a very powerful, high-level service in a way that is, really humble, kind of unassuming in all the good ways, but we're really kind of delivering incredible care, and that's where I think patients are really, really responsive to it. They never feel like they're lost in the system, if you will. They don't feel like they're just walking into a massive, sort of Borg, and they're just getting moved around from one place to another. I think they feel at home every single step of the way, and that's, I think, perfectly evidenced by just boutique is not the right word, but it's really a very sort of, maybe bespoke is the right word. It's really tailor-made for the patient. So I think the fact that we're able to do that is unbelievable, and the credit really, so much of that, all the credit really goes to you.
No,
you're awesome.
You're too kind, but thank you.
Yeah.
All right, well, it's great having you back.
Thanks,
and I personally, and I know all of us, will look forward to great things from you in the future. So
thanks.
There's no pressure, but continue the great job and delivering the fantastic care that you deliver, and And really, I think really what strikes me is your passion for healthcare and the way you manage patients and interact with them and treat them like they're one of your own family. Really, I see that in you every day.
No, thank you so much, Tim. And I just, I just want to say that I think every trainee, this is this moment, it's I'm going to remember this forever because every trainee, I think it's such an honor to be interviewed by the person you look up to so much.
Oh, thank you. All right.
So you're really what I like to say is the gold standard, or as a fellow, someone who enjoys comedy, as Don Rickles would say, you're a Cadillac.
Thank you.
Yeah,
all
absolutely.
Right. Okay. Cheers.